The doctor will see you now, alone. You'll walk into that exam room alone. You'll sit on that paper-covered table alone. You'll put on that gown that doesn't quite close in the back, alone. And for the next 15 minutes, you'll be surrounded by people. Nurses, doctors, medical assistants. But you've never felt more isolated in your life. This isn't a video about being lonely in general. This is about a very specific kind of loneliness. The loneliness of being a patient. Let me describe what this feels like. You're sick, or scared, or both. You've been worrying about this for weeks, maybe months. You've rehearsed what you're going to say. You've made lists of your symptoms. You've Googled things you probably shouldn't have Googled. And now you're here. The doctor comes in and immediately starts typing. They ask you questions, but they're not really asking you. They're asking your medical record. Any chest pain? Type, type, type. Shortness of breath? Type, type, type. Family history of heart disease? Type, type, type. You try to explain what's been happening, but you have 7 minutes, maybe 12 if you're lucky. 7 minutes to describe something that's been terrifying you for months. And the whole time you're talking, they're looking at a screen, not at you, at a screen. And that's when you realize, you're not here as a person. You're here as a case, a puzzle to be solved, a problem to be fixed, a body with malfunctioning parts. And here's the strangest part. This is supposed to be care. Care requires connection. Connection requires presence. Presence requires time. And time is exactly what modern medicine doesn't have. So you sit there, sick, vulnerable, half naked in a paper gown, surrounded by people whose entire job is supposedly to care for you. And you've never felt more alone in your life. Let's talk about a German philosopher named Martin Heidegger. In the 1920s, Heidegger wrote about something he called Geworfenheit, thrownness. This is the fundamental condition of being human. You're thrown into existence without choosing it, without a manual, without any guarantee it's going to make sense. You just find yourself here, in a body, in a world, trying to figure out what's happening, and nowhere do you feel more thrown than in a medical crisis. Your body has betrayed you. You don't understand what's happening. The language everyone's speaking might as well be ancient Greek. And the person who does understand, who went to school for a decade to understand, has 6 other patients waiting. Heidegger said that we are fundamentally alone, not because we're isolated from other people, but because consciousness itself is inherently solitary. I can never truly know what it's like to be you. You can never truly know what it's like to be me. There's always this gap, this unbridgeable gap, between my experience and your experience, between my consciousness and yours. Philosophers call this the problem of other minds. And normally, we deal with it. We build bridges across that gap. Language, empathy, love, connection. The bridges are imperfect, but they work. But when you're sick, when you're in that exam room, the gap becomes a canyon. Because not only can the doctor not truly know what you're experiencing, they don't have time to know what you're experiencing. They have 7 minutes to cross an existential chasm. Michel Foucault was a French philosopher, historian of medicine, generally suspicious of institutions. In the 1960s, Foucault wrote about what he called the clinical gaze. He traced how modern medicine transformed the way doctors see patients. Before the 18th century, doctors treated people, whole people, in their homes, in their communities, but then something changed. Medicine became a science, and science requires objectivity. Measurement, observation, data. So doctors learned to see patients differently, not as whole people, not even as sick people, but as bodies with malfunctioning parts, cases, diagnoses, problems to be solved. And here's the thing about being gazed at clinically. It's lonely, profoundly, existentially lonely, because you're not being seen. You're being observed. What's the difference? Being seen means someone recognizes you as a subject, a consciousness, a person having an experience. Being observed means you're an object, a thing to be studied, a specimen to be analyzed. You're not a person having a frightening experience. You're a case presenting with symptoms. You're not someone who's scared about what this diagnosis means for your life. You're a data point being entered into an electronic health record. You're not a human being who needs comfort and connection. You're a problem that needs to be efficiently solved so the doctor can move on to the next problem. And that is lonely. Let me tell you about Kay Toombs. She was a philosopher, and she had multiple sclerosis, and she wrote about something that most medical philosophers don't write about. Because most medical philosophers aren't patients. She wrote about the phenomenology of illness, the lived experience of being sick, and she described this fundamental disconnect. The doctor experiences your illness as an objective biological process. You experience it as the collapse of your entire world. The doctor sees a diagnosis, a set of symptoms, a treatment protocol. You're experiencing what Heidegger called the breakdown of everyday familiarity. Your body used to be invisible. Think about it. When you're healthy, you don't think about your body. You just move through the world. Your hand reaches for a cup. You don't think about it. Your legs carry you down the street. You don't notice. Your heart beats. You forget it exists. But when you're sick, your body becomes visible, insistent, demanding your attention. Except it's not really your body anymore. It's become foreign, untrustworthy, scary, and you need help understanding what's happening. You need someone to help you make sense of this body that's betraying you. You need someone to help you navigate this terrifying new world you've been thrown into. And the person who's supposed to help you, the expert, the professional, the one who knows, is checking boxes on a screen. You're in the same room, but you're in completely different worlds, and neither of you can cross over. Before we go any further, let me be clear about something. This isn't your doctor's fault. Well, not just your doctor's fault. Most doctors went into medicine because they wanted to help people, to heal, to connect, to make a difference. But somewhere between medical school and actual practice, something happened. Healthcare became an industry. Patients became consumers. Care became a product, and doctors became workers on an assembly line. Here's what modern healthcare optimizes for: efficiency, productivity, billable procedures. The average primary care appointment is 7 to 12 minutes. Doctors spend 50 to 70% of that time on the electronic health record. That leaves 2 to 4 minutes for actual human connection. 2 to 4 minutes to cross an existential chasm. 2 to 4 minutes to see someone as a person. 2 to 4 minutes to build the therapeutic relationship that every study shows is the single best predictor of health outcomes. But you know what doesn't show up on a billing sheet? Presence. You know what insurance doesn't reimburse? Connection. You know what productivity metrics don't measure? Seeing someone as a human being. Your doctor wants to connect with you, but the system has made connection unprofitable. Okay, so we've established that modern medicine is profoundly isolating. Now what? Do we just accept it? No, because some people are doing it differently. Before diagnosis, before treatment, before anything else. You listen to the patient's story, not their history of present illness, not their review of systems, their story. What's it like living in your body right now? What are you afraid of? What matters most to you? What do you need? And here's what happens when you do this. The person stops being a case. They become a person again, a subject, not an object, a consciousness having an experience. And suddenly the loneliness lessens. Not because you're no longer sick, but because you're no longer alone with it. Or here's another radical idea. Let people not be alone. Some hospitals have eliminated visiting hours entirely. Family can stay 24/7, not as visitors, as care partners. And you know what happened? Patients had lower anxiety, better pain management, shorter hospital stays, higher satisfaction. Oh, and it actually saved money. Fewer complications, fewer readmissions, because it turns out, and I know this is shocking, isolation doesn't heal people. Connection does. And then there are doctors who are just doing the simple thing. They're scheduling longer appointments, they're sitting down, they're closing the laptop, they're being present. Some are even bringing back house calls. Imagine that. Seeing a patient in their home, in their context, as a person living a life, not just a body with a problem. Revolutionary, right? Treating people like people. Loneliness isn't just a side effect of being sick. It's part of what makes you sick, and part of what keeps you sick. We've built a medical system that isolates people in the name of efficiency. We've optimized for speed. We've optimized for data. We've optimized for billable procedures. We've optimized for everything except the one thing that actually helps people heal: not being alone. The doctor will see you now. And maybe this time, they'll actually see you. You deserve to be seen, with compassion, with care, with respect, not as a billing code, not as a 7-minute slot. As a person, you deserve to be seen.